Hey, so there I am. So I want to answer this question about top tips for getting a suprapubic catheter. And a few people have asked this, I'm going to answer it in one video. So this is my top tips for getting a suprapubic catheter. Wait, I've got to think of the top tips now. Firstly, what is a catheter? Like I've said, you can have different types of catheters, which I'll go into another video, but basically you can have urethral catheters in the urethra, a suprapubic catheter, which comes out from the stomach, from the pubic bone here. If you can see, this is my judge, sorry. So I'm doing an antibiotic at the minute, but I have to go really slowly. And it's, how cool is it? It's red. And then this is my catheter here, my SPC, into the suprapubic bone, directly into the bladder. Or you can do interwelly, which is in and out, or intermittent self-catheterization. Yes, or you can have a urostomy or a Mitrinoff, but that's for another video. But for this video, I'm talking about suprapubic catheter surgery. So what are my top tips? Prep, and write down. I'm a big writer, or you can, even if you struggle to write, you can voice note on your phone. But when you go to the pre-op, before you go to pre-op, write down what your fears. What are the things that you're most worried about? Like write them all down, so then when you get there, you can tell the nurse what your fears are, and you can hopefully alleviate them, or at least talk to the team. Or if it's more medical, talk to the surgeon. If it's more anaesthetic-wise, talk to the anaesthetist, never said that word, anaesthetist about it. But I would say most important things when you go sorry, my dog Willow, it's okay, there's a CAT outside. It honestly comes around this house and just tries to come in. It's like, go away, but Willow is on board. But when you go for surgery, take a normal hospital bag, but wear loose clothing, especially around the stomach area. I wouldn't take jeans. I'd wear like jogging bottoms and loose tops or long tops. That could help. I know people talk about tubey pads, which I do use and wear, which you'll see here, but I personally would not use them straight after surgery. You want to wait until it's healed a bit. Well, mine was actually stitched in. I can't say specifically how yours will be because everyone's surgery can be slightly different. And it can be a day surgery and it can be an overnight surgery. I was actually already in hospital when I had mine done, and this was like back in 2015. So it's a bit different for me, my experience. But most people, it can be a day surgery, but if you have complications or other conditions, you might be an overnight surgery or a few days, but it can be done as a day surgery. Tubey pads I would use, but not till later on. And I actually don't use tubey pads. I actually tape my catheter down, and I tape mine down because if I don't, it moves in and out, and that is very painful for me, and that aggravates my bladder spasms. So for me, taping really helps. But again, everyone is different, but tape really helps me. Ice helps me a lot, and heat around the area, because I got a lot of pain in my urethra and kind of bladder spasms around where the area was. And for me, first of all, I drained quite a lot of blood afterwards. But again, that's me. Everyone is different, and that is normal. Also, do you know, just a few drops of blood can make the bag change colour? So don't panic if you see blood in the urine bag, and your surgeon and doctor will explain this. My other top tips are the general hospital tips of like taking your music, your headphones, a blanket, a soft teddy or cuddly toy, something sensory that, you know, keeps you at bay and makes you feel safe and happy. Taking little notes, cards to look at, distraction like your iPad, you know, things to watch, you know, all those sort of normal hospital tips, fluffy socks, things that make you feel happy and safe and good. And with an SPC as well, they will talk to you about leg bags, long night bags, or whether you need to use a flip flow. Again, it's kind of personal to preference to what works for you. And it's totally okay to be excited, because when I had my urethral catheter, it was so much pain, and then moving to an SPC, yes, there's other struggles that come with it, and it is hard, don't get me wrong, but it is so much better for me than having a urethral catheter. I remember those days, and I don't want to go there again. So yes, and the initial pain should settle down, and you can have medicines for the bladder spasms if you need medicines for the bladder spasms. And you can do flushes, and I do flushes like twice weekly, but not everyone needs that. You can get normal bladder flush outs, you can get citric bladder washouts. There are different types of ones that have medicine in it. Again, that's down to you and your urologist. I hope that's covered. I feel like I've rambled on, I've not made much sense, but I hope it makes some sense. I wanted to reply and just say that, you know, for general, you know, having an SPC, it is a big thing, but I hope it will make your quality of life better. If this is what you need, for whatever reason you need the catheter, going from urethral to an SPC should make your life a lot better. But try not to look at all the horror stories online and think, oh my gosh, I'm going to have all that pain and infections and problems. You can get infections, you can get pain, you can get spasms, but that's not everyone's story. And online, we share a lot of the kind of bad times and times when it doesn't go right, we've got infections and pain, but we don't share the times when actually it's okay and it's managing okay. So remember that. If I have anything else I could answer, then let me know. I'll show putting on a night bag, probably that'll be useful, and some other again, I don't use leg bags, putting on a night bag, morning routine, cleaning around the site. You can get granulation at first, but again, I just use like saline, a bit of water, you know. You can use steroid creams if it gets very bad, or silver nitrate to get off granulation. But again, that's me, this nurse would talk to you about, or in the community GP, etc. Anyway, I'm rambling on now, really rambling. But I hope it goes okay. For anyone having the surgery, SPC surgery, you've got this. You can totally do it. And you know what? Cool girls, gorgeous girls. I'm trying to find the right tube. I was like, that's not the right tube. That's not the right tube. Like, which tube's here? This isn't the right. I've got it connected, man. I don't really want to, guys. This is not the right tube. This is the right tube. And right now I'm connected to a bag. I'm connected to my night bag. I'll show you how long it is actually. Oh God, it's stuck. Where it is? Here is the catheter bag. I have a low immune system and get a lot of infections. So yeah, but most people you can actually use it for a few days, reuse it. But anyway, hope that helps. Oh, I don't want to go connect my TPN. I'm meant to connect fluids and TPN, but I'm just having one of those days today. Anyway, I hope that helps, and happy New Year's Eve to you all. Mwah!